I'm Dr. Philip Cordova with CORE Chiropractic, and one of the things that we really focus on here is we want to make sure that our patients are actually getting better. One of the ways that we're doing that is by taking x-rays. So if we look at this particular patient, he showed up with a -2 neck curve. So that means instead of his neck facing or having a good curve going like this, it was very straight and actually going the wrong direction. This is not uncommon with people who are at computers all day, which is 99% of our patients, who are looking down at their phones, maybe sleeping on their stomach, and their necks are going the wrong direction. The reason why that's such a big deal is, like, if you think about it like a big bowling ball sitting on top of your neck, every inch your head is going forward is like adding 10 more pounds to the weight of your neck. That means there's a lot of extra strain at the back of the head, the back of the neck, upper back, some of that pain between the shoulder blades, and that's exactly what this patient came in with. So you can see, just so you know it's the exact same person, is that he had a previous jaw fracture, and you can see some of the screws and things that are right in there. So he came in here with a -2 curve. After a few months of chiropractic care, you can get a little better shot of his jaw hardware there. He has a 23° neck curve. Now, perfect would be 35, so we still have some work to do. But this post x-ray that we took was not intended to be a all-encompassing, hey, everything's perfect now. It was just an indicator for him that things have been working. We wanted to make sure that we were on track. If we needed to make any changes to his treatment plan, at least we would know that. But he accomplished this through being consistent with his chiropractic care and also having some home care recommendations and exercises that we give to do at home. We want to be Houston's better posture chiropractors, and that means it has to be more than just what happens inside of our office. You're going to have to take a look at some of your ergonomics at your computer. You're going to have to take a look at some of the exercises and things that you're doing. But in just a short time, he was able to go from a -2 to a 23° neck curve and had an awesome result symptom-wise, but the symptoms went away very early on. This was more about changes that he could make to where it would be a lasting change. So it's not enough to just get out of pain. That happens very quickly. But if you want improved health and better posture and long-term results, you have to make some lasting changes. Now, this patient had a little different issue. So she had her head was going forward 2.25 centimeters, so about an inch. So she had a lot of headaches and neck pain as well. With the head going forward about an inch, there was a lot of extra strain being put on her neck and upper back as well. And in just a few weeks, she also was able to cut that back down by almost a whole centimeter there. But more importantly, she went from -12° to 0°. And I would say this particular patient was consistent with her chiropractic care, but not so consistent with some of the home care recommendations that we give. So one of the ways that we try to make chiropractic care more affordable and manageable for our patients is that we're not going to do everything here in our office. So you're not going to spend an hour here where you're doing a lot of rehab, a lot of exercises. Instead, those things are going to happen at home, and here we're going to take care of the thing that you can't do yourself, which is to work on proper structure and alignment, and that's what we're doing with the chiropractic adjustments. So in just a short time, she did go from -12 and a very head-forward posture to bringing her head back and a 0° neck curve. So again, we have to get to 35°, but just in a few weeks, she was able to improve by 12°. Symptom-wise, also she felt great. But as we continue to educate our patients, we don't just want you to feel better now, we want you to feel better for a long, long time. So great results here with just 2 patients, but ask yourself, how do you know if you're getting better? How do you know if you're making lasting changes to your spine? It's not enough to just go get cracked. That doesn't work. I mean, it does feel good. It does maybe make you feel better. But if you want to actually make lasting changes, you need to know how you were at the beginning and then get periodic checks to see what's changed. Are you doing the right thing? Are you going in the right direction? We occasionally do have patients who are not getting better, and so we want this x-ray to go, hey, you're not making the changes, you're not following through on the home care recommendations, or maybe we need to change something that we're doing. But you know what, without an x-ray, without a pre and a post x-ray, there's no way for us to know how much things are getting better or not getting better. Because even in those situations where the patient's curve did not improve, symptom-wise, they felt much better. But that's our concern for you, is that you not just feel better quickly and then it comes right back. We want to make sure that things make a change, and that's what this helps us do. Thanks for your time today.